Hi everyone, my name is Dr. Oge O and welcome back to my channel. So today I want to talk about rosemary oil versus topical minoxidil. I know that the paper that came out comparing rosemary oil to topical minoxidil came out a few years ago, and the hype around that has kind of died down, but I still think it's an interesting topic, and I hadn't fully done a deep dive and fully read the original paper, so I wanted to do that and just give my thoughts on it, especially as someone who has tried both rosemary oil and topical minoxidil for hair growth. Just wanted to give some insights to anybody who's considering either or product from somebody who is an almost dermatologist. So let's just get right in. So I want to start by just going through how both of these products work to increase hair growth. So for rosemary oil, it's got two main ways that it increases hair growth. The first is it has a component in it that dilates blood vessels, which means that it makes blood vessels bigger. That allows for more nutrients to get to the hair follicles. More nutrients to the hair follicles means that it gets more of what it needs to grow your hair longer, stronger, better. It also is thought to be an antioxidant, which is really great because we have seen that the sun can also damage the structure of the hair. So a lot of sun can also lead to weakened strands and hair damage. And so rosemary oil acts as an antioxidant to prevent against that potential sun damage that you can get just from everyday living, being outside. So minoxidil works a little bit differently to help with hair growth. One of the things that it does, it also dilates the blood vessels, gives more nutrients, hair follicle gets what it needs, it can grow faster, longer, stronger. But what it also does is it extends the anagen phase. So your hair goes through your hair follicle, I should say, because that's where the hair grows from, but your hair follicle goes through multiple different stages. So you have an anagen phase where your hair is actively growing, it's connected to the blood supply, it's getting everything it needs. That's basically the time, when your hair is actively growing. And then you get to a point where you get to the end of that phase, and that's when that growth stops. That's catagen. And then you get to telogen, which is where it's cut off from the blood supply. Your hair is not actively growing anymore. And one way to know if a hair is in telogen is if you pull it out, you'll actually see the white bulb. That's basically the end of the hair follicle has been disconnected from the blood supply. So that's how you can know if a hair is in telogen versus if it was in the anagen growth phase. It's also a way for you to know if your hair is breaking off or if it's shedding. If you have that bulb at the end, then your hair is shedding. And then finally you have the exogen phase, which is when the hair falls out completely. And so your hair follicle goes through these normal cycles, and anagen is really the only time where your hair is going to be growing. And so minoxidil is really cool because it actually extends that phase. And fun fact, minoxidil actually started off as a blood pressure medication, and they saw that people who were taking minoxidil for their blood pressure, for high blood pressure, were noticing increased hair growth. So it was a favorable side effect that was noticed during this medication. Okay, so now that we've clarified what both of these products do, I want to get into the actual study. So I want to make sure I get the title right, and the title is Rosemary Oil versus Minoxidil 2% for the treatment of androgenetic alopecia, a randomized comparative trial. And so for this study, I assumed that they were talking about minoxidil 2% solution, not the foam, because they said that it was in a 1 milliliter dropper, and the solution comes with a dropper versus the foam, you kind of just spritz it out, and that does make a slight difference that I'll talk about later on in the video. But I'm assuming that that's what they used, and they said they used more like a rosemary lotion that they compounded, and so those were the formulations that they used for this study. And it was single blind, and I couldn't quite tell if it was I'm assuming it was the participants who were blinded in the study, which means they didn't know which solution or topical they were getting, but the researchers and the people evaluating them did know what each person was getting, just to kind of give some overall context to this study. So going into the study, they had each participant use each of the products as 1 milliliters twice a day with 12-hour intervals in between for 6 months. And this is how you're supposed to use topical minoxidil. So they looked at results at baseline, 3 months, and 6 months. And this is very important because hair grows about 1/2 inch to 1 inch a month. And again, a lot of this is determined by your genetics. And then usually it takes about a month for you to even start to see any sort of hair growth. And so you need to give it time to really see hair growth. And that's honestly for anything that you're using for hair growth. You have to give it time. It's not gonna be, there's no overnight pill or solution that you can use that will immediately grow your hair. And that's anything in life. It's gonna take time. And so it was important to make sure that they were on a long enough regimen that you would actually see progress. And so they did note that the participants in the rosemary oil group noted higher satisfaction and they perceived higher amounts of hair growth in the rosemary group, specifically at the 6-month period. So there was no statistically significant difference in increased hair growth between the two groups, but there was a statistically significant difference between decreased hair shedding between the two groups. And so the rosemary group perceived that they had decreased hair shedding. So I thought this study was very interesting when I really took a look at it and looked at the data. I also looked at a few other articles just to kind of see if there was anything else out there about minoxidil and rosemary. And so kind of my final thoughts about all of this is, first, one thing I want to mention is that they used minoxidil 2%, which for men, we start them at 5% minoxidil, and we can even go up as high as 10%. And then even for women, even if we start you off at a low dose, then we try to get you up to that higher dose. So I will say they were using a suboptimal dose of topical minoxidil in this study. And I think when talking to other dermatologists about this study, that's kind of the criticism we have about it, because it didn't actually compare standard of care treatment to rosemary, which is a big thing, because you want to make sure, okay, is this better than what the standard of care that we're already using is? And so I think that would have been interesting to actually see 5% minoxidil compared to rosemary oil and see if it was getting the same results. Another thing that I thought was interesting, or that I thought was important, was talking about irritation, the dryness, and greasy scalp, because that can be a limiting factor for a lot of people using these products, especially since for the irritation, a lot of times it's the vehicle. And so I mentioned that I assumed it was the solution, and that makes a big difference because the minoxidil solution has propylene glycol, which can cause a lot of irritation. And so for people who get very irritated or have very sensitive skin, minoxidil foam is more recommended. And so that's why I think it's also important to distinguish between which of the two were used. And as I said before, there was significantly increased itching in the minoxidil group, and I wonder again if that's because it was using the minoxidil solution, which has propylene glycol, which is more irritating than minoxidil foam. So I guess for final thoughts, what do I think? Which one should you use? And honestly, I think first, definitely, if you are experiencing hair loss, I repeat again, get professional help. Go to a dermatologist, even see a trichologist, see somebody who can actually take a look at your scalp, get your history, potentially do a biopsy to give you the correct diagnosis, because there are certain types of hair loss that are not going to respond to topical minoxidil or rosemary oil. And so I think it's very important that you first figure out what you're actually dealing with before you start trying to buy a bunch of things and different treatments. You want to know, is this even going to work, or do I need something completely different? And I would say the sooner you get in to see somebody, the better. I think I've seen so many patients in my clinic who they come to us when they are at the end stages of hair loss, and I get so sad for them because I just think, oh man, if we caught this early, we probably would have been able to reverse this, but now we're at a point where we really can't do anything, and it really is going to just be covering up. And it's just so sad and heartbreaking, because I would say, just if you're feeling anything, if you just notice, I think there's more shedding, I think that I just have more itch, things feel more swollen, tender, get it checked out as soon as possible. Don't just let it go. And I think there's this kind of prevailing idea that beauty is pain, and no, it is not. It does not have to be painful. Things should not be painful on your scalp. So seek help as soon as possible, as soon as you notice something is off. But then if you know that you are dealing with a type of hair loss that can benefit from either of these, then what should you do? And to give you more context, some of the hair losses that I think could benefit from either topical minoxidil or this rosemary oil is androgenetic alopecia. This article does show us that at least compared to 2%, rosemary oil does have is very efficacious. Some other types of hair loss that I think could also benefit are some of traction alopecia. And so traction alopecia is when you have mechanical stress to the hair. So you're wearing tight buns or tight ponytails or braids, and basically you pull the hair follicle out before it's ready to actually enter that exogen phase where it's shedding. And so you're having mechanical stress to the hair. And so topical minoxidil in that case can help, just as your hairs are regrowing, extending that anagen phase, giving them more time to grow and get to a length that you're comfortable with and happy with, and just kind of help those follicles as they're regrowing. Of course, the definitive treatment is to stop with the tight hairstyles, and I know it's hard. I love a good like slick back ponytail, and even for the crown braids that I'm wearing now, I realized that if my hair isn't stretched, it just puts too much tension. So now I blow dry my hair before putting the crown braids, and if I feel any sort of tension whatsoever, even if it's just like a light ding, I take them out. And that's just so important. For traction alopecia, the definitive treatment is stopping the mechanical stress, because at some point, if you continue doing that, even if you are using minoxidil, you'll eventually enter a scarred phase where you will no longer be able to grow that hair. Those follicles are under so much damage and so much tension that they basically give out, and you won't be able to grow that hair back. So but topical minoxidil can be something that's helpful as you're kind of regrowing those hairs if you have lost your hair due to traction alopecia. Another type of hair loss / alopecia that could be helpful is telogen effluvium. And telogen effluvium usually happens after a very stressful event. So something, whether you're had a really bad illness or you are very stressed out at work, anything that puts your body under a lot of stress. And you basically just have lots of hair shedding. Also, you might know patients who are, or people who are pregnant, once they give birth, they can have like increased hair shedding just because of the hormone changes and everything that goes on with giving birth and being pregnant. So topical minoxidil can help in telogen effluvium by preventing more hairs from entering that telogen phase and staying in that anagen phase. It can also again help with just regrowing hairs as they enter back into that anagen phase and just helping them along. But again, definitive treatment is either curing the stressor or getting rid of the stressor. And just personal story, I actually was using topical minoxidil as well as topical rosemary oil because I was experiencing telogen effluvium. Throughout just kind of the whole medical school journey, residency, there's been pockets of time where I was just under so much stress. Another type of alopecia I think could be helpful, where topical minoxidil, topical rosemary oil can be helpful, is anagen effluvium. So this one's slightly different. Anagen effluvium is usually seen after people who are undergoing chemotherapy. And so one of the things with chemotherapy is it attacks rapidly dividing cells, and you get a lot of people who lose their hair. And so neither of these treatments are going to help while you're getting the chemotherapy because the chemotherapy actually it attacks the structure. And so even if you do, neither of these are gonna prevent that from happening. But it's really helpful for patients after they are done with chemotherapy to, again, increase the anagen phase, dilate the vessels, give their hair follicles the best chance of coming back. And the great thing is most people who, after they do finish chemotherapy, are able to grow their hair back. I just wanna clear up some other misconceptions about both of these treatments. So for minoxidil, I've heard a lot about people saying that once you stop it, then you'll lose all of your hair, so it's not even worth it. And I just wanted to clarify that first. For topical minoxidil, if you're using it for androgenetic alopecia, standard of care is to add something else onto it. So most people who are using topical minoxidil or were prescribed topical minoxidil for androgenetic alopecia are also prescribed something to actually block the effects of the hormone that is driving androgenetic alopecia. So it makes sense that if you were to stop, if you're only on topical minoxidil and you stop it, your hair will go back to what it was previously because you are no longer actually attacking the problem. And so it's a continual problem that you have to stop. And again, I think that's why it's so important to make sure that you actually see a professional so you understand what's going on versus some of these other hair losses that I talked about. So for telogen effluvium, because it's not a hormone related, it really is just mine is very stress related. Once I'm out of that stress phase, my hair normalizes, and my normal hair growth cycle, that's what I want it to go to. So of course, if you're using it because you have very thin hair and now you want to grow a thick mane, and if you were to stop, yes, you would go back to your normal hair growth, but that's for anything that you use. So any of these other vitamins, pills, all of this, basically once you stop it, then your body reverts back. Your body loves being in balance, and so it will go back to its normal, its balance with anything that you use. So just wanted to clarify that for people who are worried about that when using topical minoxidil. And then also another thing, topical minoxidil, you do a lot of times see this kind of initial shedding phase, and that's normal. It normalizes, and so some people don't experience it. I didn't experience it any of the times that I've used topical minoxidil, and so it's just one thing to look out for. So if that is something that happens to you, it doesn't happen to everyone though. And then another thing, again, with the foam versus the solution, just if you do get some irritation and with the solution, try the foam if it's something that you want to stick with, because the foam doesn't have that propylene glycol, and it's going to be less irritating than the solution. So you can kind of like play around with it. Look at the back to see that as long as the active ingredient is minoxidil, and then just know over the counter 5% is the highest. So if you're not seeing what you want with 2%, go up to the 5%. If you're not having side effects, which could be like headache, lightheadedness, then go up to the 5%, see what happens. And then with rosemary oil, I want to say definitely look to see what the carrier oil is. And so rosemary oil is an essential oil. It can be very irritating if you apply it directly to your skin. And so it usually isn't a carrier oil, especially if you are somebody who has sensitive skin. If you do have a lot of allergies, just make sure you check what carrier oil is being used. So what is my thoughts of everything now that we've kind of gone through the study, we've gone through how both are used, you've heard my personal experience, what are my thoughts? So personally, I think that if you know what type of hair loss that you have, and you know that it's one that can benefit from either topical minoxidil or rosemary oil, I would say it's just whatever your preference is. You know, if you're most concerned about cost, then choose whatever's cheapest. If you're concerned about what's easiest to access, choose whatever is easiest to access. If you want to try both, try both. You know, there's nothing wrong with doing that. They're very low side effect profile treatments. And so I don't think it has to be this either or sort of thing. You can try both. You can try one and then try the other. And then I think just the big thing is just make sure that you're informed about what these treatments do and then what you're actually treating, and be realistic about results. I think that's the biggest thing. But yeah, that's my takeaway from all of this. Hopefully it's been super helpful and it's helped somebody who has been considering starting either or both of these, and it's giving you just a little bit more insight into hair loss in general. So my biggest takeaway, if you notice something that is off on your scalp, something that's irritating, you're losing a lot more hair than normal, get help as soon as possible, because a lot of times these types of hair losses in the initial stages are reversible and you just need to catch it early. But yeah, hopefully this has been helpful. Until next time, bye.